I'm Dr. Yuraj Kumar, Chairman, Department of Orthopedics and Robotic Joint Replacement. I'm going to talk about robotic joint replacement because conventional joint replacement is being done for many years, but the robotic joint replacement has been added to this for last 1 or 2 years. So what is robotic joint replacement? The robot which we have is US FDA approved debut Johnson & Johnson company made 𝐸Z𝐶 robot. So the name of the robot is 𝐸Z𝐶 and we are using that robot. So what happens, what are the advantages of the robot, why we are using this robot? So if we use the robot, the precision and accuracy of the implant gets increased. The soft tissue handling is less. We call it resurfacing. Why we call it resurfacing? Because if you see this, the bone, this is the knee joint. So only the damaged cartilage is removed. The natural bone of the patient is preserved. So there is less soft tissue handling, less bone cut and no blood loss, no ICU stay and no suture, and patient is almost remain painless and the recovery is very faster. So this is the advantage of our robotic joint replacement, and we discharge patient in very short period of time and patient return to their social activity maybe within 2 to 3 weeks. So how this robotic joint replacement is helping to our patients, we are seeing in our more than 100 or 200 patients, operated patients. Thank you.